now we're just going to have some questions. What bone is A trying to identify? That would be the maxilla. The termination of what nerve exits B, and what is its function? The inferior alveolar nerve exits at the mental foramen, becomes the mental nerve, which is sensory to the lower lip and the skin of the chin. The masseter muscle is innervated by which nerve? If you answered C, the mandibular division of the trigeminal nerve, which would be V3, you are correct. The mental foramen is most commonly found between the first and second premolars. Books, there is a little bit of variation, but that is the most commonly found area. In explaining the pain caused by the drilling, which is a terrible word, of a mandibular molar tooth crown to a freshman medical student, a dentist identified the nerve conducting the pain sensations as which one? If you answered C, inferior alveolar, you would be correct. To drain an abscess, which is a closed collection of pus affecting the cheek area, an emergency room physician used local anesthesia for the surgery. Which of the following nerves must be anesthetized because it carries pain sensation from the cheek area? Is it A, B, C, D, or E? If you answered A, the long buccal, you are correct. Remember, the buccal nerve, or the long buccal nerve, is a branch of the mandibular division of the trigeminal nerve that transmits sensory information from the skin of the cheek area and the oral mucosa of the cheek. A 38-year-old patient complained of acute dental pain. The attending dentist found penetrating dental caries, so dental decay, affecting one of the mandibular molar teeth. Which nerve would the dentist need to anesthetize to work on that tooth? A, B, C, D, or E? If you answered B, you are correct. The IA nerve, the inferior alveolar nerve, is a branch of the mandibular division of the trigeminal nerve, again V3. It penetrates the mandibular foramen and is the sensory nerve for the mandible and all mandibular teeth. Okay, which nerve is endangered during surgical removal of an impacted third mandibular molar tooth? Is it the hypoglossal, glossopharyngeal, inferior alveolar, or the lingual nerve? If you answered C, inferior alveolar nerve, you are correct. Remember that this nerve runs in the mandibular foramen and it's located near the roots of the teeth, so it might be endangered when removing an impacted tooth. Two more questions. A cranial fracture through the foramen ovale that compresses the enclosed nerve will have an effect on all muscles except A, B, C, D, E. If you answered C, you would be correct. Remember that the mandibular division of the trigeminal nerve is transmitted through the foramen ovale. Branches from the nerve innervate the muscles of mastication, like the temporalis and the masseter. A branch from V3 also innervates the tensor tympani, which is a muscle that dampens the vibrations of the tympanic membrane. remember that the mylohyoid is innervated by a branch of the inferior alveolar nerve, which is also from V3. The mylohyoid muscle elevates the hyoid bone and the tongue and depresses the mandible. Remember that the mylohyoid forms the floor of the mouth. The buccinator, which is the correct answer, remember that is a muscle on the side of the cheek, keeps the food on the occlusal table, and that is innervated by the facial nerve. Okay, our final question. A 46-year-old female patient comes to the emergency department complaining of pain in the area just below her mandible on the right side of her face. She says that the pain is particularly severe when she eats. The area of the submandibular gland is tender and swollen, as is the area in the floor of her mouth lateral to the tongue. You suspect a stone in the submandibular duct, and a plain film radiograph shows a density in that region consistent with the stone. In order to remove the stone, the duct must be incised in the floor of the mouth. What nerve that loops around the duct is in danger in such an incision? Is it the coda tympani, glossopharyngeal, hypoglossal, the internal branch of the superior laryngeal, or the lingual? The correct answer is the lingual nerve. The lingual nerve is found in the floor of the mouth, and it wraps around the submandibular duct. So that nerve might be injured as you try to remove the stone from the submandibular duct. The lingual nerve contains sensory fibers for the anterior two-thirds of the tongue and fibers from the coda tympani that provide taste to the anterior two-thirds of the tongue. All of these sensory components might be lost if the lingual nerve was damaged. Now remember that the trigeminal nerve is the most important nerve in dentistry. So please take time to really understand through your readings the trigeminal nerve, as this will come up again in 4th semester when you're learning about the administration of local anesthesia.